Hey everyone, certified lymphedema therapist here. Let's go step by step through a lymphatic drainage routine to help move fluid for right leg swelling and lymphedema. If you want printable handouts, check out the links in the description box down below. So we're going to dive right in, but if you have any new symptoms or pain, always check in with your doctor for clearance for safety. It's also best to do this routine directly on the skin if you're able to, and this is something that can be done daily. Everyone needs to find a position that's comfortable for them, but if someone has issues reaching their leg, then pulling in a friend or family member might be helpful. So first we're starting with 4 deep breaths to stimulate the deeper lymphatic structures. This will increase flow of the lymphatic fluid through the larger vessels. Placing your hand on your abdomen, gently pressing inward for some pressure, take a nice big deep breath in through your nose, and then exhale and repeating. Then we're going to go on to stimulating the lymph nodes that are right around the collarbone or clavicle area, doing 8 to 10 circles on one side, and then repeating and doing 8 to 10 circles on the opposite side. All of the fluid in the body have to go towards this area before moving back to the heart, so we want to make sure that it's working. Then we want to stimulate the lymph nodes that are out throughout the body to make sure that the whole system is working together. So we can stimulate the lymph nodes that are right below the ear, on the sides of the neck, 8 to 10 times. And then we want to start to stimulate the lymph nodes that are in the armpit area on the right side. 8 to 10 circles directly in the armpit. We also want to stimulate the lymph nodes that are in the left groin, the left inguinal lymph nodes, doing 8 to 10 circles right about where the sitting crease is. And finally, we want to stimulate the lymph nodes that are right in the right groin, where all the fluid in the right leg needs to go to get out of that leg. Next, before we move down the leg, we want to decrease any congestion in the area first. So we're going to guide the fluid from the right groin over towards the left groin, doing 3 to 5 strokes across that lower pelvis or lower abdomen area. Then we also want to guide any fluid from the side of the body up towards the armpit on the right side. So from the right groin all the way up the side of the body towards the right armpit. Again, decongesting any fluid that's sitting around those lymph nodes to make way and make sure it's clear for the fluid from the leg to then get out. Now we're going to start moving the fluid. So we want to think about wrapping any fluid from around the low back or the low glute area up and around the body towards the lymph nodes in the front. Then we're going to start to move down the leg, starting from the knee, working our way up towards the groin or towards the front of the hip. Do 3 to 5 strokes in each area. When doing this, it's best to try to use as much of your hand as possible, as much surface area as possible to be effective. As we work behind and on the sides of the leg, we want to start to move the fluid up and around towards the front where those lymph nodes are in the groin. If someone has any what we call fibrosis or thickened area, we can spend more time in that region. Or if someone has more fluid, it's okay to spend more time there as well. After we've moved as much fluid as possible in the thigh, then we're going to start to work down the leg. Next, we're going to go around the knee. So guiding the fluid around that kneecap, around the patella, on the sides of the knee as well. And then we want to go to behind the knee and do a handful of circles because there are lymph nodes behind the knee as well that can help move fluid from the lower leg out of the area. You can also try to move the fluid from around those tendons back behind the knee. Then we're going to work down into the lower leg. So finding a position that works best for you, working from the ankle to the knee, 3 to 5 strokes on all sides of the lower leg. The strokes in this area can go directly upwards. They don't have to wrap towards the front of the lower leg. Trying to use as much of your hand as possible. And then making sure to also get behind the lower leg or as far as someone is able to reach. Once we spent as much time as needed in the lower leg, then we can move on and work towards the ankle area. Spending time around the ankle bones, where the fluid may be stubborn and sit or pool. Working in the front of the ankle, in the back of the ankle. And it's okay to use your fingers a little bit more to make sure that you get into those crevices. Then we can go on to the foot, working on the top of the foot. And also into the toes. Some may just use their whole hand across their toes. If someone has more swelling in their toes, they may want to spend more time with each toe individually before moving on. After spending as much time as you like, then we're going to start to work up towards the ankle area again, working around the bones before moving up to the lower leg. Spending time guiding the fluid from the ankle up towards the knee. Doing the same thing, doing 3 to 5 strokes on all sides of the lower leg. If someone is able to lay down with their leg above their heart during this, the gravity may assist as well. But because this is a difficult area to reach, finding the position that works best for you is ideal. After finishing the lower leg, then we're moving on to the knee, working around the bone, on the sides of the knee, and then spending some time in the back of the knee around those tendons, and also re-stimulating those lymph nodes. Then we're going back to the thigh area, from the knee all the way up to the front of the hip, to those lymph nodes in the groin. Guiding the fluid up. And again, as you work onto the sides of the thigh or even behind the thigh, start to wrap that fluid up around towards the front. As we work back up into the hip, the goal is to wrap that fluid around towards the front. And then we want to move the fluid out of that congested area. So guiding the fluid across to the opposite groin, from the right to the left. Again, this is best done directly on the skin if able. Doing 3 to 5 strokes across, and then we can also move the fluid up the side of the body from that right groin area towards the lymph nodes in the right armpit. 3 to 5 strokes all the way up. Then we want to finish, after we've moved as much fluid as possible, with 4 more deep breaths. So putting our hand on our belly, gently pressing inward, take a nice big deep breath in, and let your breath out, and repeat that 3 more times. This will help re-stimulate all of the fluid that's from the lower leg through the abdomen trunk to get back towards the heart. And that's a full sequence for lymphatic drainage to the right leg for lymphedema or swelling. Again, be sure to reach out to your doctor or certified lymphedema therapist for more personalized guidance. Otherwise, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.